can uterine conditions impact female fertility? Imagine trying to plant a seed in soil that's not quite right. The uterus is like that soil, and if it has issues, it can make pregnancy more difficult. Uterine conditions can really influence a woman's ability to conceive and carry a pregnancy to term. The uterus's main job is to support the developing embryo, so any problem that affects its shape, size, or lining can cause fertility challenges. One common issue is uterine fibroids and polyps. Fibroids are benign tumors made of muscle tissue, and polyps are overgrowths of the uterine lining. When these grow inside the uterine cavity, especially if they are larger than 6 centimeters, they can block sperm from reaching the egg or prevent the embryo from implanting properly. They might also change the shape of the uterus or reduce blood flow to the lining, making it less receptive to pregnancy. Sometimes women don't notice symptoms, but others may experience abnormal bleeding, cramping, or pain. Removing fibroids or polyps often improves fertility chances. Congenital uterine anomalies are structural differences present from birth. These include conditions like a bicornuate uterus, which has 2 horns, or a septate uterus, where a dividing wall runs inside the cavity. These malformations can limit the space available for a pregnancy, increase the risk of miscarriage, or cause preterm labor. They can also make it harder to conceive because the uterus isn't shaped normally to support implantation. Intrauterine adhesions, also called Asherman's syndrome, are scar tissues that form inside the uterus, often after surgery or infection. These adhesions can block the uterine cavity, disrupt the lining, and cause irregular periods. They can prevent an embryo from implanting or lead to early pregnancy loss. Treatment usually involves surgical removal of the scar tissue. The health of the endometrial lining itself is also vital. The lining needs to be thick enough, usually between 8 and 13 millimeters, to support an embryo. If it's too thin or too thick, the chances of successful implantation drop. Sometimes, hormonal issues cause the lining to develop improperly after ovulation, which is called a luteal phase defect. This can make pregnancy difficult even if conception occurs. Endometriosis and adenomyosis are conditions that involve tissue growth related to the uterine lining. Endometriosis involves tissue growing outside the uterus, often on the ovaries or pelvic organs, leading to inflammation, scarring, and adhesions that can block fallopian tubes or interfere with ovulation. Adenomyosis is when endometrial tissue grows into the muscular wall of the uterus, causing it to become thickened and painful. Both conditions can distort the uterine environment and reduce fertility, though their impact varies from woman to woman. Overall, uterine conditions can interfere with fertility by blocking sperm or egg movement, preventing the embryo from implanting, or increasing the risk of miscarriage. Diagnosis often involves imaging tests like ultrasound or MRI, and sometimes a hysteroscopy, which allows direct visualization of the uterine cavity. Treatment options depend on the specific condition and can include surgery to remove fibroids or polyps, correction of structural anomalies, or managing endometriosis and adenomyosis. Understanding and managing uterine conditions is especially important for women with endometriosis, as it is a uterine-related condition that can make fertility even more challenging. Every woman's situation is unique, so personalized care from healthcare professionals is essential. If you are experiencing infertility or symptoms like abnormal bleeding or pelvic pain, it's important to seek medical advice. Proper diagnosis and tailored treatment can significantly improve your chances of achieving a healthy pregnancy.